Bipolar disorder. Dr. K. Redfield Jamieson, an esteemed psychologist and professor of psychiatry, stands among the leading experts on bipolar disorder worldwide. Throughout her career, she has dedicated herself to studying, teaching, and authoring pivotal works on this complex condition. Remarkably, Jamieson has first-hand experience with bipolar disorder, having navigated its challenges since early adulthood. In her memoir, An Unquiet Mind, she offers an intimate portrayal of life with bipolar disorder. She recounts episodes of sleepless nights, extended euphoria, and a mind so filled with rapid visionary thoughts that she would pour them out into notebooks. During these manic highs, Jamieson felt an overwhelming sense of confidence, often acting on impulses that seemed gratifying in the moment but brought lasting repercussions. Her manic episodes led her to extravagant spending, risky behavior, significant credit card debt, and emptied bank accounts. But these euphoric states inevitably gave way to deep depressive episodes, leaving her emotionally devastated. At age 28, in the grips of intense despair, she attempted to end her life by overdosing on lithium. Although she fell into a coma, she survived, emerging with a resolve to seek the support of medication and therapy. Through her research and writings, Dr. Jamieson has greatly advanced our comprehension of bipolar disorder, depression, and the spectrum of mental health challenges we now classify as mood disorders. She has become a prominent advocate, showing that people can lead productive, fulfilling lives even while managing mental illness. Like anxiety disorders, which we explored earlier, mood disorders are often misunderstood. Jamieson's work has been invaluable in clarifying these complex issues for both the scientific community and the public. Mood disorders. Media often misrepresents mood disorders, reducing depression to something that can be cured by a day at the spa, or labeling someone as manic depressive just because they were sad one day and felt fine the next. As psychology students, our role is to gain a true understanding of mood disorders, including their symptoms, underlying causes, and the complex ways they manifest. This is a challenging area to study, as these disorders can drag people from exhilarating highs to profound lows of despair that seem endless. However, as Dr. K. Redfield Jamieson describes, there can be a rich, imaginative life woven between these emotional extremes, all influenced by one's moods. What are moods? While we've encountered terms in psychology that often differ from everyday meanings, mood actually aligns with what you might expect. In psychology, moods are subjective emotional states, even more personal and challenging to define than emotions themselves. While psychologists generally identify about 10 primary emotions, moods are usually grouped into two broad and highly variable categories: positive moods and negative moods. Unlike emotions, which are typically brief, moods are longer-lasting emotional states, often persisting over time. Mood disorders, then, are marked by intense emotional shifts and persistent struggles in mood regulation, presenting as more enduring disruptions rather than passing feelings. These include depressive disorders, characterized by sustained feelings of hopelessness and fatigue, as well as bipolar disorders, which prominently involve cycles between depressive and manic episodes. Depressive disorders. Depression is sometimes referred to as the common cold of mental health conditions. This doesn't mean it isn't serious. Rather, it's widespread, affecting many people, and remains the primary reason individuals seek mental health support. Most people have felt low or down at some point, typically due to specific events like a breakup, job loss, or the death of a loved one. In these instances, feeling sadness is natural and can actually help the mind and body process loss. Typically, these feelings are temporary. However, when sadness and grief go beyond typical expectations or become so severe that they disrupt daily functioning, it can indicate a depressive disorder. The DSM-5, our primary, though imperfect, guide for diagnosing mental health conditions, defines major depressive disorder as occurring when a person experiences at least 5 symptoms of depression for over 2 weeks. These symptoms extend beyond sadness and can include significant changes in weight or appetite, excessive or insufficient sleep, lack of interest in activities, feelings of worthlessness, fatigue or lethargy, trouble focusing or making decisions, and recurrent thoughts of death or suicide. While everyone goes through moments of sadness, depression is both a physical and psychological condition. It disrupts sleep patterns, appetite, energy levels, and neurotransmitter balance, affecting the body's normal functioning. To be classified as a psychological disorder, depression must also bring ongoing distress, leaving the person or those around them with a deep sense that something is seriously wrong. Just as someone with severe generalized anxiety may feel unable to leave their home, someone with clinical depression can feel so overwhelmed and hopeless that daily life becomes difficult to manage. Unlike bipolar disorders, depressive disorders are typically marked by persistent lows. Bipolar disorder. You may have heard the term manic depression, which is the older name for what we now call bipolar disorders. These disorders involve not only intense depressive episodes, but also periods of mania in more extreme cases. A person with bipolar disorder may shift between normal, depressed, and manic phases within days, weeks, or even a month. A genuine manic episode isn't just feeling energetic or positive. It's a phase of extreme, restless, often upbeat hyperactivity, where self-perception and judgment can become dramatically distorted. This skewed perception can cause people to believe in exaggerated ideas about themselves and their abilities. Some individuals only experience mania infrequently, but when they do, it can be highly disruptive. Dr. Kay Jamieson has recounted some of her own manic episodes, which vividly illustrate this. In one instance, she bought out a drugstore's stock of snakebite kits, convinced she alone could foresee an upcoming rattlesnake invasion. In another, she purchased 20 books from Penguin Publishing, saying, "It would be nice if the penguins could form a colony." Bipolar disorder. You may have heard the term manic depression, which is the older name for what we now call bipolar disorders. These disorders involve not only intense depressive episodes, but also periods of mania in more extreme cases. A person with bipolar disorder may shift between normal, depressed, and manic phases within days, weeks, or even a month. A genuine manic episode isn't just feeling energetic or positive. It's a phase of extreme, restless, often upbeat hyperactivity, where self-perception and judgment can become dramatically distorted. This skewed perception can cause people to believe in exaggerated ideas about themselves and their abilities. Some individuals only experience mania infrequently, but when they do, it can be highly disruptive. Dr. Kay Jamieson has recounted some of her own manic episodes, which vividly illustrate this. In one instance, she bought out a drugstore's stock of snakebite kits, convinced she alone could foresee an upcoming rattlesnake invasion. In another, she purchased 20 books from Penguin Publishing, saying, "It would be nice if the penguins could form a colony." In short, mania often leads to poor judgment, and in severe cases, it can become highly damaging. Severe manic episodes frequently lead to psychiatric hospitalization due to the risks they can pose to the individual and those around them. When the manic phase ends, it's often followed by deep depression. Without treatment, suicide or suicide attempts are common. An experienced Dr. Kay Jamieson has openly discussed genetic causes of mood disorders. As with many psychological conditions, mood disorders are typically influenced by a mix of biological, genetic, psychological, and environmental factors. Studies show that mood disorders tend to run in families, indicating a genetic component. For instance, if close relatives like parents or siblings have bipolar or depressive disorders, one's risk of developing these conditions is higher. Research on identical twins has shown that if one twin is diagnosed with bipolar disorder, there's a 70% chance the other will also be diagnosed, regardless of whether they were raised together. Environmental triggers of mood disorders. Although a stressful life event can't cause bipolar disorder, it can trigger a manic or depressive episode in someone already predisposed to it. Similarly, for someone who has never experienced depression, a significant loss can potentially lead to a major depressive episode. For example, Losing a loved one might turn sadness into depression or trigger a bipolar episode in someone with an underlying vulnerability, though it wouldn't be the root cause of the disorder. In the case of depressive disorders, for most people, depression eventually subsides after weeks, months, or even years, allowing for a return to healthier functioning. Globally, women are diagnosed with major depression more often than men, although many psychologists believe this is due to higher rates of women seeking treatment. It's also possible that depression in men may manifest more as anger or aggression rather than sadness or hopelessness. This highlights how depression is far more complex than merely feeling sad. Its characteristic lack of motivation and sense of helplessness can show up in diverse ways. Mood disorders and the brain. When examining mood disorders from a neurological standpoint, we see distinct brain activity patterns in depressive, manic, and average brains. A brain in a depressive state tends to slow down, while a brain in a manic state exhibits heightened activity, making it difficult for the person to rest, concentrate, or sleep. Neurotransmitter imbalances also accompany these mood states. For instance, norepinephrine, a chemical that typically increases alertness and energy, is found at low levels in depressive states, but surges during manic episodes. In fact, medications that reduce mania often work by lowering norepinephrine levels. Low serotonin levels are also linked to depressive states, which is why physical activity, known to boost serotonin, is often recommended for depression. Many antidepressants aim to increase serotonin or norepinephrine levels to manage symptoms. Social cognitive perspective on mood disorders. Another way to approach mood disorders is through a social cognitive lens, which considers how our thoughts and behaviors influence depression. People with depression often interpret negative events through a personal lens that worsens their outlook. The way we explain events to ourselves, positively or negatively, can significantly affect our ability to recover from setbacks. Imagine a scenario. You trip in the lunchroom, spilling soup and sitting on a brownie, and it's just a bad day. A depressive mindset might interpret this as an endless humiliation, seeing it as a personal failing and a sign of general inadequacy. This cycle of negative thinking, self-blame, and over-analysis can feed on itself, robbing the mind of joy and creating a self-perpetuating cycle of negativity. The good news is that this cycle can be interrupted through professional support, engaging in enjoyable activities, shifting focus outward, and potentially changing one's environment. However, the social cognitive perspective is just one part of a larger picture. While positive thinking is valuable, it may not be sufficient alone to combat genetic or neurological factors. Mood disorders are complex conditions and often don't resolve with a single solution. They're often lifelong challenges to manage rather than completely eliminate. Dr. Jameson's life shows us that it's possible to live well while managing a mood disorder. Review and credits today. We explored what mood disorders are and what they are not. We covered symptoms of depressive and bipolar disorders and considered the potential genetic, biological, environmental, and social cognitive factors contributing to mood disorders. Thank you for watching this episode.